Imagine tuning into Green Table Talk, and they've got like an update on the latest cannabis research. That's kind of what we're going for today. We're going to be pulling out the most interesting findings from some recent studies.
Yeah, we're going to look at everything from like anxiety in cancer patients to how cannabis use is changing, especially for like older adults.
Okay, so we've got four sources for this deep dive, all pretty recent. One is this randomized clinical trial from the December 16th, 2024 issue of JAMA Network Open, Oncology. It tested CBD for anxiety in women who have advanced breast cancer.
We also have a systematic review from 2014 in Aging Research Reviews, and they looked at medical cannabinoids in older patients.
And we've got a 2017 prospective study from the European Journal of Internal Medicine that explored the safety and efficacy of medical cannabis in the elderly. And then plus a study from Addiction that same year that's looking at trends in older cannabis users in the US.
Yeah, so basically what we're going to do is break down what these studies tell us about both the benefits and the risks, particularly for older adults, and what it all means for you.
So let's just get right to it. I think for older adults or anyone caring for them, the first question is probably like, is this even safe?
Right, and the study from the European Journal of Internal Medicine gives us some helpful data on that. They followed over 2,700 patients. All of them were over the age of 65. And they were prescribed medical cannabis between 2015 and 2017. And their average age was 74 and a half, so a good representation of that older population.
Okay, so that's a pretty big group. What were they using it for?
Mostly pain and cancer, which is pretty typical. But the interesting thing is, after 6 months, over 93% of them said that their condition had improved, and their pain scores went down significantly.
Hold on, 93%. That's a huge number. Was that just like based on them saying they felt better, or was there like some other measure?
Well, they used a couple of measures. First, patients rated their pain on a scale of 0 to 10, with 10 being the worst pain imaginable. Before using cannabis, their median pain score was 8. After 6 months, it had dropped to 4. So that's a pretty significant reduction, and that makes it more likely it's a real effect, not just chance.
Wow, that is a big improvement. But we also have to talk about side effects. What were they seeing there?
Well, most of the side effects reported were mild, things like dizziness and dry mouth, which are pretty common with cannabis in general. But the promising thing is that a lot of the patients in the study were able to reduce how many opioids they were taking, and some even stopped completely, which is a huge potential benefit, especially given the opioid crisis.
Yeah, that makes a lot of sense. So are there other studies that kind of back this up, that cannabis can help people manage pain?
Well, there's the 2014 systematic review from Aging Research Reviews. They looked at a bunch of different controlled trials that involved older adults and medical cannabinoids. And while it didn't find like clear efficacy for every condition, it did point out that we need more age-specific research in this area.
So what works for a 25-year-old might not work for a 75-year-old.
Exactly. Older adults often have other health issues, and they're taking a lot of different medications, so we need to be really careful about interactions. That review really stressed the importance of personalized medicine, really taking individual needs and risks into account.
You know, it is really interesting that they found such a high rate of improvement in that European study. It almost makes you think we should be prescribing cannabis more often for chronic pain, especially as an alternative to opioids.
Yeah, that's definitely a conversation that needs to be had, but we have to remember that this was just one study, right? We need more research before we can say anything definitive.
Right, of course. So we've talked about pain, but what about anxiety? Is there any evidence that cannabis can help with that, especially for older adults?
Well, that's where that JAMA Network Open oncology study comes in. They focused on women with advanced breast cancer. They often experience anxiety before scans to assess their tumors, which is totally understandable. It's a really stressful situation.
So this trial was specifically looking at whether CBD could help manage that pre-scan anxiety.
Yeah, exactly. They had 50 women, and they were randomly assigned to get either 400 milligrams of CBD or a placebo. And they measured their anxiety using something called the Visual Analog Mood Scale, or VMS. It's basically a pretty simple way to figure out how someone is feeling.
Okay. And what did they find? Did the CBD work?
Well, the results were a little mixed. The primary endpoint of the study was to see if there was a change in anxiety scores before and after taking the CBD. And that wasn't statistically significant.
So they didn't see a strong enough difference between the CBD group and the placebo group to say for sure that the CBD was causing any anxiety reduction.
Right. But they did find that women who took the CBD reported having lower overall anxiety levels 2 to 4 hours later compared to those who took the placebo. Now, this was a secondary finding, meaning it wasn't their main focus, but it's still pretty interesting.
Wait, so if the change in anxiety wasn't significant, how can the overall scores in the CBD group be lower? I'm a little confused.
Yeah, it all comes down to how the study was designed and some statistical things. They chose to use the change in anxiety scores as their main endpoint because they assumed that everyone would start with pretty high anxiety and then they would see a drop.
So they were comparing each person to their own baseline anxiety level.
Yes, exactly. But what they found was that those who started with the highest anxiety before taking the CBD actually had the biggest drops afterward. And they think this could be due to something called regression to the mean. Basically, when measurements are really extreme at first, they tend to become less extreme over time.
So if someone is super anxious before a scan, their anxiety is likely to go down a bit just naturally, even without the CBD, because it's hard to stay at that peak level of anxiety all the time.
Exactly. And that might have messed with their results. The authors suggested that maybe they should have focused on people with moderate or severe anxiety because those with mild anxiety might not see as much of a change.
Okay, so it sounds like even though the study didn't definitively prove that CBD caused a big reduction in anxiety compared to a placebo, there were some signs that it might be helpful.
Right. And it's important to remember that this was a small study. There were only 50 people involved, and they were all women. We need larger studies and more specific studies to really confirm these findings, and they only looked at one single dose. We don't know how using CBD a bunch of times might affect anxiety or what the long-term effects could be.
Good point. So we're seeing some promising early signals, but definitely not a green light to start using CBD for anxiety without talking to your doctor, especially if you're older and might be taking other medications.
For sure, it's super important to consider the possibility of interactions, especially in older adults who might be on a lot of different medications.
Speaking of older adults, that study from Addiction that looked at demographic trends, they had some crazy results. I mean, a 250% increase in cannabis use among people 65 and older,
Yeah.
that's mind-blowing. What's driving that kind of growth?
Well, there are probably a lot of factors. We're seeing more acceptance of cannabis, right? Both for medical and recreational use, which might make older adults more willing to give it a try.
Plus, the baby boomer generation, who are now in that older adult age range, has historically been more open to cannabis use than, previous generations.
Absolutely. And don't forget, this data is from between 2006 and 2013, so it's likely that cannabis use has gone up even more since then with all the legalization that's happening.
That's a really good point. But what kind of concerns me is that the addiction study also found that most of the older adults who are using cannabis believe there's little to no risk involved.
Yeah, and that is worrying, especially with everything we were just talking about with those potential side effects and drug interactions.
Exactly. It really shows how important it is to have more research, specifically looking at the long-term effects of cannabis use on older adults. How does it affect things like thinking, heart health, the risk of falls?
I agree. We need to understand how cannabis interacts with other medications that are typically used by older adults. As we were talking about, older adults might process drugs differently than younger people because of age-related changes in their liver and kidneys. And they might have more body fat, which can affect how those cannabinoids are stored and released in the body.
It sounds like we've got a lot more to learn. But this European study, the one that found those high rates of improvement in older adults using medical cannabis for things like pain, seems like a good place to start. What else can you tell us about that study?
Oh, yeah, that's a great point. I'm glad you brought that up. Let's take a closer look at those findings because I think they offer some valuable insights into the potential benefits of cannabis for this age group.
Yeah, so this European Journal of Internal Medicine study really breaks down how older adults are using medical cannabis. Over 2,700 patients, they were followed for 6 months. And like we said, almost 94% reported some kind of improvement.
Incredible. So what exactly were they using the cannabis for? Pain was the biggest reason. Like about 2/3 of the patients were using it for pain management. And then cancer was the second most common reason, around 60%.
Okay, so mainly pain and cancer. What types of pain, though? Were they specific?
The study didn't get into specifics, but it was probably like a whole range of chronic pain conditions, the kinds that are more common in older adults. Things like arthritis, back pain, nerve pain, that sort of thing.
Right, right. Makes sense. So how did they measure this improvement? Was it just did the patient say they felt better or what?
They used a couple of different methods, actually. First, they just asked the patient straight up, like, do you feel better or worse after 6 months of this cannabis treatment? And that's where that, like, super impressive 94% improvement number comes from.
Okay, so they were just reporting how they felt?
Yeah.
But did they also track, like, actual pain levels?
Yeah, they did. They had patients rate their pain on a scale of 0 to 10, with 10 being, the worst pain you could possibly imagine. And before they started using the cannabis, their average pain score was 8. After 6 months, it was down to 4. So that's a big drop. And statistically speaking, it's significant.
Yeah, I mean, that means it's pretty unlikely that that kind of shift happened just by chance, right? It
Well,
really seems like the cannabis was helping them.
totally. And this could be really huge for older adults. A lot of them are dealing with chronic pain, and they have to rely on these strong painkillers that often have a ton of side effects. Did they look at if the cannabis impacted their other medications, though?
They did. And this is where things get really interesting. About 18% of the patients in the study were either able to completely stop taking opioids or they were able to, like, lower their dose. And this was after they started using the cannabis.
Wow, that's a pretty powerful argument for considering medical cannabis as like a real alternative to opioids, especially for older people who are more sensitive to the side effects.
Yeah, of course, we need more research to back that up, but it's a pretty good start.
Yeah.
What about the downsides, though? Like, the study looked at side effects, right?
They did. Dizziness and dry mouth were the most common ones, which is pretty typical with cannabis use. About 10% said they felt dizzy, and then about 7% had dry mouth.
Okay, but were there any, like, serious side effects?
They didn't find any serious problems that were directly linked to the cannabis, but there's one thing that they pointed out.
Whoa.
Falls.
Falls. Really? That seems kind of random.
I know, right? But remember, falls are a huge concern for older adults. They can lead to some pretty bad injuries. And the researchers found that a little over 20% of the patients in the study said that they had fallen at least once in the 6 months after starting to use cannabis.
Hmm. That's definitely something to keep in mind. But do we know if the falls were because of the cannabis?
That's the thing. The study couldn't say for sure. It's possible that the dizziness some people experience from cannabis might be a factor, but it could also be completely unrelated.
Because older adults are more likely to fall just in general.
Right, exactly. Maybe their muscles are a bit weaker, they might have problems with balance, or their vision isn't as good. So we really need more research to figure out how big of a role, if any, cannabis might be playing in falls in older adults.
Yeah, so it's not like a clear cause and effect,
Yeah,
but definitely something to watch out for, especially for people who are already at risk of falling.
I agree. I think the takeaway here is that even though medical cannabis seems really promising for older adults, there are still some risks involved. And it's really crucial for people to be monitored by their doctor, talk to your healthcare provider. Open communication is key.
Totally. This is not something to jump into without talking to your doctor,
Yeah.
especially with everything we've discussed about potential side effects and how cannabis might interact with other meds.
Absolutely. And don't forget, everybody reacts differently to cannabis. There's no one-size-fits-all approach here.
Right, right. Okay, so we've covered safety and efficacy, and we've talked about how older adults are using cannabis more and more these days. But can we go back to anxiety for a sec? The JAMA study that looked at CBD for anxiety in women with breast cancer, were there other limitations to that study besides just small sample size?
Oh, yeah, definitely. I mean, one of the biggest things to consider is that they only gave a single dose of CBD. So we don't know how repeated doses might affect anxiety, like if there be any long-term benefit, or even if any new risks might come up with using it over and over again.
It's like we're only getting a glimpse, right? Just a snapshot in time.
Exactly. And this was a very specific group of women. They all had advanced breast cancer. We can't just assume that these same findings would apply to men or to people with other types of cancer, or even to women who have breast cancer, but it's at a different stage.
So we really need more research to see if these findings are true for other groups of people.
Exactly. And it's important to point out that they used a pretty high dose of CBD. It was 400 milligrams, which is much higher than what a lot of people would typically take if they were just using it on their own.
So we don't know if the lower dose would have worked just as well, or even better, or if maybe there would be more side effects at the higher dose.
Yeah, there's still so much to learn about the right dose and how that impacts both the benefits and the risks of using CBD for anxiety.
Okay, that makes sense. It seems like with cannabis, we still have way more questions than answers.
Hmm.
But these studies give us a lot to think about. It's fascinating how much attitudes are changing around cannabis. especially among older folks.
It really is. It'll be interesting to see how things continue to evolve, especially as we learn more about both the good and the bad, the potential benefits and the risks.
Yeah, and speaking of evolving, let's go back to that addiction study for a sec. That huge jump in cannabis use among older adults.
Hmm.
What do you think that means for the future of cannabis research?
Hmm. That's a great question. I think it definitely shows us how much we need more research in this area, especially long-term studies. And they should focus specifically on this growing group of older cannabis users. We have to understand how it affects their overall health and well-being as they age.
Yeah, and how it interacts with other age-related changes and conditions, right?
Yeah.
Like what if someone is already taking medication for, say, high blood pressure or diabetes? How does cannabis fit into all of that?
Exactly. There are just so many potential interactions and things to figure out. It's really complex.
It really feels like such an exciting time for cannabis research, though. It seems like all the time there's a new discovery. But it's important to remember that with those discoveries, we also get new questions, right?
Totally. We have to be cautious and responsible in how we're dealing with all this new information
Hmm.
and always, always put open communication between patients and their doctors first.
So if someone is thinking about using cannabis, what's like the best advice you can give them?
Talk to your doctor. Seriously, that's the first thing. Be upfront about why you want to try cannabis. Talk about any concerns you have. They can really help you weigh the potential benefits and risks and figure out if it's even right for you.
And if you do decide to try it, start slow, right? Low dose,
Yeah.
see how you feel. Don't feel like you have to take more than you're comfortable with.
Yeah, exactly. Listen to your body. If you're having any side effects you don't like, just stop and talk to your doctor.
That's really good advice. It's all about being informed and making the choices that are right for you. Before we finish up, I want to go back to that study on CBD for anxiety in women with breast cancer. I think there's something really important to talk about, which is like the difference between the primary and secondary endpoints in that study.
Yeah, I agree. That's a key concept. It can really help people understand how research actually works and how to interpret what those studies are telling us. Let's dig into that a little bit more.
Okay, so let's break down this whole primary and secondary endpoints thing, because I think it can be kind of confusing if you're not like, a research nerd.
Yeah, it's a really important difference, though. The primary endpoint is basically what the researchers are most interested in. Like, that's the main question they're trying to answer with the whole study.
Okay.
So in that JAMA study, it was whether a single dose of that CBD led to a statistically significant change in anxiety levels, compared to the placebo. And they were looking at it right before and right after taking it.
And they didn't find a statistically significant difference there, right, for that primary endpoint.
Nope. Which means they couldn't say for sure that CBD was the reason for any of the anxiety reduction.
Gotcha.
Now, secondary endpoints are like other things that they're measuring in this study. They can be interesting, they might give us extra information, but they're not the main focus.
So in this study, the secondary endpoint was that the women who got the CBD had lower overall anxiety a few hours later compared to the placebo group.
Exactly. And, it was noticeable, this difference. But it wasn't statistically significant, so it kind of hints that CBD might be helpful, but we can't, make any firm conclusions based on that.
So it's like, we got a little clue, but not enough to like solve the whole mystery.
Haha, that's a good way to put it. It suggests that it's worth looking into more, maybe with a bigger group of people or a different study design.
That makes sense. It seems like research is often like this. It's a process. You get closer and closer to the truth, but you don't always find like a definite answer right away.
Oh, for sure. It's a lot of trial and error and building on what we already know. And sometimes, what seems like a setback can actually help us understand things even better.
It's like when you think you've hit a dead end in a maze, but it turns out to be like a shortcut to the finish line.
Huh, I like that.
Ah,
Research can be like navigating a maze, but the journey is just as important as, actually reaching the destination.
totally. So as we wrap up here, are there any other kind of final thoughts you want to leave our listeners with about the future of cannabis research?
Well, I think, we covered a lot today. We talked about pain management, we talked about anxiety, and we talked about how the people who are using cannabis are changing, especially that increase in older adults. It's pretty obvious that cannabis is a hot topic right now, both in research and just, in our culture. And as it becomes more mainstream, it's even more important that people have reliable and accurate information.
Yeah, especially for older adults.
Oh.
More and more of them are turning to cannabis for all sorts of reasons, but they might not be aware of the risks or how it could interact with the other meds they're taking.
Exactly. So if there's one thing I want people to take away from this, it's be informed, you
Mm.
know? Do your research, talk to your doctor, and make the choices that are right for you.
That is great advice. And for anyone who wants to dig a little deeper, there are some really great resources available online. The National Institutes of Health, they have a whole website dedicated to cannabis research.
Mm.
And there are organizations like the National Institute on Drug Abuse and the Substance Abuse and Mental Health Services Administration. They have a lot of evidence-based info on both the risks and the benefits of using cannabis.
Oh, yeah. Those are all great resources. And don't be afraid to ask questions, The more we talk about cannabis openly and honestly, the better we'll all be at making good decisions about it.
Very well said. Thanks for joining us on this little exploration of the latest in cannabis research.
Of course, it was my pleasure.
And to all our listeners out there, stay curious and stay informed.